The military dog had been calm all morning, until he wasn't. He hit the end of his leash so hard the handler stumbled sideways, and then the animal was loose, 200 pounds of muscle and scar tissue tearing across the clinic lobby while people flattened against the walls. He could have gone anywhere. He went straight to her. The quiet nurse in the corner with the ruined arm, the one nobody talked to, the one everybody wrote off. And when he reached her, he didn't attack. He dropped. Hit the floor like something had cut his legs out, pressed his scarred muzzle against her scarred skin, and trembled like he'd just found the only person left from a war nobody in that room knew she'd survived. Before we go any further, if you're new here, hit that subscribe button right now, because this channel is where stories like this live. Stories about the people nobody sees coming. Hit the like button if you're already hooked, and drop a comment telling me what city or country you're watching from. I want to see how far this story travels. Now let's get into it. The rain started before dawn and didn't stop. By the time Nora Callahan reached the parking structure at Hargrove Regional Medical Center in Denton, Virginia, the gutters were running full and the humidity had settled into that particular weight that made everything feel slower, heavier, like the air itself was pushing back. She pulled her jacket tighter across the back of her neck, not because she was cold, but because of habit. The same habit she'd carried for 7 years. The instinct to keep the scarring on her left shoulder and neck covered until she was inside and moving and too busy for anyone to stare. She wasn't ashamed of the scars. She was tired of explaining them. Hargrove Regional was a mid-sized hospital, busy enough that a good nurse could disappear into the pace of it, which was exactly what Nora had wanted when she transferred from a position upstate 3 years ago. She kept her head down, did her work, stayed off the radar. The ER staff respected her in the quiet, functional way people respect someone who never drops a task and never asks for recognition. She wasn't popular. She wasn't unpopular. She was simply there. Efficient, reliable, and almost entirely invisible, which was how she preferred it. She badged through the side entrance and moved down the corridor toward the locker room, passing the charge desk where 2 night shift nurses were handing off today's. One of them, Priya Okafor, glanced up and gave Nora a tired nod. They'd worked together long enough that the nod was enough. Trauma Bay 3's been busy, Priya said without preamble. MVC, 2 pedestrians, one of them coded twice. Stabilized now, but it's going to be a day. It's already a day, Nora said. She stored her bag, changed into her scrubs, and was at the medication cart within 4 minutes of arriving. This was her rhythm. Most people on staff didn't know much about her beyond the basics. She'd worked ER nursing for 7 years. She was from somewhere in the mid-Atlantic. She had a scar situation that ran from behind her left ear, down under her collar, and presumably continued beneath the sleeve she always kept rolled down. She was quiet in handoffs, precise with patients, and had a habit of positioning herself so that her left side faced the wall. Nobody asked. She didn't offer. The morning moved the way Tuesday mornings in an ER move. One thing bleeding into the next. No clean breaks. The minutes stacking up until suddenly it was past 11, and Nora realized she hadn't eaten since the granola bar she'd had in the car. She was finishing a wound irrigation on a construction worker named Terrell, who had taken a nail gun to the forearm and was handling it with impressive composure when her charge nurse, a blunt, efficient man named Marcus Webb, appeared in the doorway. "Administration wants you," he said. Nora didn't look up from Terrell's arm. "I'm with a patient." "When you're done." The tone told her something. Marcus wasn't dramatic by nature, but there was a flatness in his voice that wasn't routine. She finished with Terrell, documented the treatment, handed off to the floor nurse, and walked down the hall to the cluster of offices near the back of the ER. Operations Director Dr. Stephen Harlan was waiting for her. Harlan was in his early 50s, well-dressed for a hospital administrator, with the particular confidence of a man who had never once doubted that his opinion was the most important in any room. He was standing behind his desk rather than sitting, which Nora recognized as a staging decision, a way of making the other person feel like they'd been called to stand in front of a principal. She stood. "Close the door," he said. She did. "I've been going through this patient feedback from last week." He lifted a folder, then set it down without opening it. Another performance. "There's a complaint from the Ellison family. You remember that case?" Nora did. 63-year-old woman, brought in unconscious, possible stroke presentation. The attending on duty had ordered a standard protocol and stepped out to handle a call. Nora had noticed a pressure inconsistency and made a call that diverted the patient to imaging 20 minutes ahead of schedule. The attending, Dr. Alan Pruitt, had been irritated. The patient had survived with significantly less neurological damage than she might have otherwise. The family expressed concern, Harlan said, that a nurse made clinical decisions that should have been left to the attending physician. The attending wasn't in the room, Nora said. That's not the point. It was the point when her pressure was dropping. Harlan's expression shifted, not to anger exactly, but to something adjacent to it, the look of a man who found disagreement from certain people personally offensive. Callahan, this isn't the first time I've had to have a conversation like this with you. You have a pattern of overstepping, of acting like your instincts override protocol. The patient was deteriorating, and there was a physician managing her care. There was a physician down the hall on a phone call. He let the silence sit for a moment. Then, I'm putting a formal note in your file. If there's another incident like this, I'll be recommending termination to HR. He picked up his pen, which was the signal that she was dismissed. You're a competent nurse, Callahan, but you need to understand your role. Nora looked at him for a moment. Not defiantly. She was past the age of defiance as a reflex. She looked at him the way you look at something you've already categorized and don't need to examine further. Understood, she said. She walked out. The rest of the shift moved the way. The rest of those kinds of shifts always moved, with a particular mechanical quality, every action deliberate, her thoughts running on a lower frequency beneath the work. She had learned a long time ago to separate the noise from the task. The noise was Harlan. The task was the patient in front of her. She had learned that lesson in conditions that made a hospital administrator look very small and very manageable. She never told anyone that. The animal was behind the ambulance bay. Nora found it near the end of her shift when she cut through the back lot to her car. The long way. The route that avoided the main entrance where two news vans had parked for some story she hadn't followed. The dog was wedged between the dumpster and the concrete retaining wall, and she almost walked past it in the rain before she caught the sound. A low, wet breathing that didn't match the pattern of the storm. She stopped, crouched. The dog was large, some kind of mixed breed, heavy through the chest, with a deep laceration running along its left shoulder and what looked like road rash down its flank. It had been hit by something. A car, probably. It wasn't in shock, its eyes were tracking her. But it wasn't moving either, which meant it was either too hurt to move or smart enough to know that moving would make things worse. Okay, Nora said quietly, not to reassure it, just to fill the silence while she assessed. She went back inside, grabbed supplies from the storage closet off the loading area, gauze, saline, irrigation solution, tape, a pair of gloves, and was back outside in 3 minutes. The dog watched her come back. Didn't try to move away. She worked methodically. Cleaned the laceration, irrigated the road rash, applied pressure, assessed the leg that was bent at an angle she didn't like. The dog flinched twice and made no sound either time. Good, she said. It took her 40 minutes. By the time she was done, she was soaked through her jacket and her knees ached from the crouch. She had the dog stable enough to transport and had already called the emergency veterinary clinic on Alderman Street, the one that stayed open past 10 on weekdays. Marcus Webb found her in the parking lot while she was figuring out how to get the dog into her car. Callahan. He stared at the dog, then at her, then at the bandaging. Harlan's going to lose his mind if he sees this. He already lost his mind, she said. Help me lift this dog. Marcus helped her lift the dog. The Alderman Street Veterinary Clinic was not a military facility. It was a well-lit, relatively calm practice that handled standard companion animals and had an emergency service that ran on a skeleton crew after hours. When Nora came through the door carrying a 60-pound mixed breed wrapped in her jacket, the young technician at the front desk, a woman whose name badge read Delia, stood up immediately. What happened? Hit by a vehicle, I think. Shoulder lack, road rash, possible fracture in the left front leg. I cleaned and irrigated. She's been stable for 40 minutes. Delia was already coming around the desk. Are you a vet tech? No, Nora said. I'm an ER nurse. They move fast, which Nora appreciated. The on-call veterinarian, a tired-looking man named Dr. Finch, appeared from the back and took over the assessment without wasting time on preamble. Nora gave him the rundown, what she'd found, what she'd used, the dog's responses, and he listened without interrupting, which was also something she appreciated. Good call on the irrigation, he said, examining the laceration. This would have been infected by morning. He glanced up at her. You said you're ER? 7 years. He nodded, went back to the dog. Nora stepped back toward the lobby to give them room to work. There were 2 other people in the waiting area, a teenage boy with a cat carrier and an older woman with a small terrier in her lap. The television on the wall above the reception desk was playing local news on mute, captions scrolling. She was standing near the window watching the rain when the door opened. The man came in first. I was in his mid-30s, lean in the particular way that suggested not a gym, but years of moving and carrying and not having enough consistent food. He had a leash in his left hand, a heavy tactical lead, the kind with a padded handle, and he was looking back over his shoulder at something behind him. The something was a German shepherd. The dog was old, 9, maybe 10. His muzzle was silver, his gait carried the stiffness of a dog whose joints had weathered more than they should have, and there was scarring across his right shoulder that Nora recognized immediately as something other than an injury from falling downstairs. He walked beside the man with the deliberate, measured pace of an animal that had been trained so deeply that the training had become the animal. He also had a vest. Military working dog. Retired, given the age, but the vest was recent issue. Someone was keeping his identification current, which meant someone cared. The man, the handler, leaned down to say something to the dog, checking his gait, and the dog allowed it without breaking stride. They moved toward the reception desk together. The young tech, Delia, was already looking up their appointment. Nora looked away, back toward the window. She didn't know what made her look back. The dog had stopped. He was 6 feet from her, and he had stopped in the middle of the lobby with his head raised and his nostrils moving. Not alert. Alert looked different. She knew that somehow from somewhere she didn't immediately reach for. This was something else. Recognition. The specific stillness of an animal that has encountered something familiar in a place where familiarity was not expected. The handler noticed the dog had stopped and looked up from the desk. The dog took 1 step toward Nora, then another. The handler said, "Ghost, heel." The dog's ears moved in acknowledgement, and then he ignored the command entirely, which, based on the handler's expression, was something that essentially never happened. He crossed the remaining distance to Nora in 4 steps, pressed his scarred muzzle directly against her left arm, the covered one, the scarred one, and exhaled. Then he sat down and pressed the full weight of his shoulder against her leg. The lobby had gone quiet. Delia behind the desk wasn't moving. The teenage boy had put down his phone. The handler was staring at Nora with an expression she couldn't fully read, somewhere between recognition and something that looked almost like grief. "Ghost," he said again, differently this time. His voice had dropped. The dog didn't move. Nora looked down at the animal against her leg. She could feel the trembling, subtle, deep, the kind of trembling that comes not from cold or pain, but from something that has been held for a very long time, suddenly not being held. She didn't move either. The handler crossed the lobby slowly and crouched in front of the dog, eye level, the way someone does when they're trying to understand something rather than correct it. He looked at Ghost for a long moment. Then he looked up at Nora. He was quiet for 3 seconds that felt much longer. "Callahan," he said. "Nora Callahan?" Her chin moved. Not a nod, not a denial, just the involuntary response of a body that had spent 7 years building a wall and just felt the first brick shift. The handler's jaw tightened. He stood up slowly, all of it slow, like a man who was trying not to startle something that had only just stopped running. "I was looking at her the way you look at something you thought was gone. Not the comfortable gone of the past, but the specific terrible gone of a casualty report." "Ryder," he said. "Eli Ryder." She didn't say anything. "I was with Bravo Element," he said. "The Fallujah convoy, 2017. The fluorescent lights buzzed. The rain hit the windows. Nora Callahan stood very still with a retired military working dog pressed against her left leg and felt the name of that place move through her like a physical thing, like pressure change, like the moment before a door opens onto something you are never going to be able to unsee. She had spent 7 years making sure nobody in Denton, Virginia knew her name from anything except a hospital ID badge. 7 years of rolled down sleeves and deflected questions, and the particular practiced art of being present without being known. And a dog had just walked across a veterinary clinic lobby and undone all of it in the time it takes to exhale. Ghost pressed harder against her leg. Eli Ryder was watching her face with the expression of a man who had not expected to find something alive that he had long since mourned. Outside, the rain hit the pavement in sheets. Inside, Nora finally let herself look at the man she was supposed to have died before she ever met again. She said his name like she was testing whether it was still real. Ryder. Yeah. He didn't move toward her, smart enough to understand that whatever was happening inside her right now was not something that responded well to being rushed. Yeah, it's me. Ghost was still pressed against her leg, still trembling in that deep-held way. The dog's eyes were half closed, and there was something almost pained in his stillness, like an animal that has been carrying something for so long that putting it down felt dangerous. Nora looked at the dog for another moment. Then she crouched, brought herself level with him, and placed her right hand, the unscared one, flat against the side of his face. Ghost turned into it immediately. The trembling didn't stop, but it changed quality, became something more like a shudder moving through and then out. Hey, she said softly. Just that. Eli watched this and said nothing. Behind the desk, Delia had gone very quiet in the specific way of someone who understands they are witnessing something they don't have context for. The teenage boy had abandoned any pretense of looking at his phone. Even the old woman with the terrier had gone still. Nora stood back up. She kept her face controlled, which was a skill she'd had for years and which was currently costing her a significant amount of effort. "How did you find me?" she said. "I didn't," Eli said. "We came in because Ghost's been favoring his left shoulder for a week. The appointment was at 8:30. He paused. "I didn't know you were here. I didn't know you were anywhere." She registered that, filed it. "When did he start tracking people?" she asked, and she meant it as a deflection, a practical question to create distance. But something in Eli's expression shifted. "He doesn't," he said. "In 9 years, I have never seen him break a heel command. Not once." He looked at the dog, then back at her. "Not until right now." Delia finally spoke from the desk. "I can take Ghost back whenever you're ready, Mr. Ryder. Dr. Finch is free in about 10 minutes. "Give us a minute," Eli said without looking away from Nora. The lobby stayed quiet. Nora crossed her arms, a protective gesture she was aware of making and made anyway. The rain was heavier now, audible against the roof. "I'm not going to talk about the convoy," she said. "Not here." "Okay. Or anywhere, probably." "Okay," he said again, steadily. "People think I'm dead." "I know. I'd like to keep it that way." He was quiet for a moment. Not the silence of someone building an argument, but the silence of someone who understood that what she'd just said carried the full weight of 7 years and wasn't going to be moved by a counterpoint. "I'm not here to blow up your life, Callahan. I didn't come in looking for you." He rubbed the back of his neck, a gesture she didn't recognize as practiced, which meant it was real. "But Ghost found you, and I don't know what to do with that either." Nora looked down at the dog. Ghost was watching her with the particular attention of an animal that has made a decision and is waiting to see if the decision holds. "Get his shoulder looked at," she said finally. "Make sure it's not a rotator issue." She walked past them toward the door. She made it as far as the parking lot. She stood in the rain for 60 seconds, hands in her jacket pockets, looking at nothing. Then she went back inside and sat down in one of the waiting room chairs like someone who has run out of options, which was not a feeling she was comfortable with, but which was apparently where the night had decided to put her. Eli came out of the back 30 minutes later. Ghost walked beside him with the careful gait of a dog being evaluated, which meant Dr. Finch had wrapped the shoulder for observation and recommended restricted activity. The same recommendation, Nora noted, she would have given for a soft tissue strain in a human patient. Some things translated. Eli sat down across from her. He didn't try to open with anything smooth. He just sat and let the silence be what it was. After a while, Nora said, "How many of them made it?" He understood what she was asking. "All of them," he said. "The 3 from the second vehicle, Sergeant Pelham, Vargas." A brief pause. "All of them that you pulled out." She nodded once, looking at the floor. "Dawes lost the leg below the knee," Eli said. "But he's doing okay. He's in Raleigh now, got 2 kids." She absorbed this the way she absorbed most things. Without visible reaction, the information going somewhere internal where she processed it later, alone. This was a coping mechanism that had kept her functional through things that had broken other people, and it had also made her very difficult to know. The official record says you were lost in the secondary collapse, Eli said carefully. That's what they told us, that you went back in for Dawes and the K9, and the ceiling came down. Part of it did, she said. How did you get out? She looked up at him. Slowly. He let it go. They sat there for another few minutes, not quite comfortable but past the worst of the initial shock. Ghost lay between their chairs with his chin on his paws, eyes moving between them in an unhurried monitoring pattern that was so deeply trained it had become instinct. I built a life here, Nora said finally. It wasn't defensive, just factual. I can see that. It's not a big life, but it's mine, and it's quiet, and I need it to stay that way. Eli nodded. He leaned forward, elbows on his knees. I'm not going to say anything to anyone. That's not who I am. He paused. But Callahan, people should know. What you did on that road, people should know. Why? The directness of the question seemed to catch him without a ready answer. Because it matters, he said. To who? He didn't answer that because there wasn't an easy answer that didn't sound like a platitude, and he seemed to understand she didn't have patience for platitudes. What he didn't say, but what sat between them anyway, was that it mattered to him. That he had lived for 9 years with the specific weight of watching someone disappear into smoke, and being told that was the end of the story, and finding out it wasn't the end was doing something to him he hadn't yet found the language for. Nora stood up. I have a shift at 6. Okay. Don't follow me, she said. Not harshly, practically. I won't. She said goodbye to Delia, who was professional enough not to ask any of the questions she was clearly sitting on. Nora walked to her car, sat in the driver's seat for a moment in the rain, and then drove home. She didn't sleep much. Stephen Harlan arrived at Hargrove Regional the next morning with the focused energy of a man who had decided something and was moving forward with it before he could think better of it. Nora became aware of this at 9:47 when Marcus Webb appeared at the supply room door with an expression that was carefully neutral in a way that meant it was working hard to be. He's calling for you again, Marcus said. Nora capped the syringe she was preparing, set it aside, stripped her gloves. Okay. Nora. He said her first name, which he almost never did. He called HR this morning before rounds. I heard it through the door. She looked at him. Just watch yourself, he said. She walked down the hall. Harlan's office felt smaller in the morning light, or maybe she was just tired. He was sitting this time, which was interesting. Yesterday's power stance replaced by something that looked almost rehearsed, like he'd planned this out and decided seated played better. There was a woman from HR named Judith Crane sitting to his right with a notepad open in her lap. Nora sat across from them without being invited to. Thank you for coming in, Harlan said, which was the kind of thing people said when they wanted the opening to sound reasonable. I was already here, she said. I started at 6. Right. He opened a folder. I've been made aware that you were at the Alderman Street Veterinary Clinic last night, after your shift. She waited. I've also been made aware that you treated an animal in the parking lot of this hospital using supplies taken from our storage area. A dog was injured in the back lot. I stabilized it and transported it for veterinary care, using hospital supplies. Wound irrigation materials and gauze. I'll replace them out of pocket if that's the concern. Judith Crane was writing something, which was theater. If this was actually about gauze, there wouldn't be a meeting. That's not the primary concern, Harlan said. The concern is that you are exhibiting a pattern of behavior that suggests you believe your personal judgment supersedes established institutional guidelines. The Ellison situation. Now this. He set down the folder. I also spoke with Dr. Pruitt this morning. He expressed serious concerns about your conduct in Trauma Bay 3 last week. I documented everything I did in that bay, Nora said. It's in the chart. The documentation isn't the issue. The issue is... Then what is the issue, Dr. Harlan? She kept her voice level. Because I've been here for 3 years. My patient outcomes are in the top quartile of this ER. I haven't had a substantiated complaint. She paused. I'm trying to understand what specifically I've done wrong. Harlan's jaw moved. He was not a man accustomed to being asked to be specific. Your attitude, he said, is the issue. It was such a naked answer that it briefly silenced the room. Even Judith Crane's pen stopped moving. Nora sat with it for a moment. 7 years of keeping things internal. 7 years of knowing when to retreat and when to stand and when to simply let the other person finish talking, because finishing talking was all they actually needed. I understand, she said. I'm placing you on a formal performance improvement plan. I understand, she said again, still level, giving him nothing to push against. Effective immediately. You'll be under review for 90 days. Any further deviation from protocol will result in termination proceedings. Judith Crane was writing again. Nora looked at the window behind Harlan's desk. The rain had cleared overnight and the morning was sharp and cold, the kind of light that showed everything exactly as it was. She thought about Ghost pressed against her leg in that lobby, trembling like he'd been carrying something that was finally too heavy. She thought about Eli Ryder saying people should know, and her asking to who and not having a good answer. She thought about the fact that this man sitting across from her, who had never worked a trauma bay in his life, was about to put a document in her file that said she was a problem. Anything else? She said. That will be all, Harlan said. She stood, nodded once at Judith Crane, and walked out. The call came at 11:15 while she was in the middle of an IV placement on a 70-year-old man named Harold, who had opinions about everything and was sharing all of them. It was Eli. She almost didn't answer, but Harold was currently monologuing about the proper way to make a roux and wasn't going to notice a 30-second pause, so she stepped back. What? She said. I need you to know something before you hear it from someone else. His voice had a specific quality that she recognized as someone delivering information they know is going to land badly. I talked to a couple of guys last night, after you left, people who were there. I told you not to say anything. I know. I'm sorry. It wasn't intentional, Callahan. Vargas called me while I was still in the parking lot. He could hear it in my voice that something had happened, and he pushed. A beat. He's telling people. The information settled in with a particular heaviness. How many people? As of this morning, at least 4. Pelham, Vargas, Marcus Obi, and Dawes. He paused. Dawes took a flight last night. What? He booked a flight from Raleigh. He's landing in 40 minutes. She pressed her free hand against the wall. Harold was asking from the bed whether everything was okay, and she told him yes and meant it as a short answer, not a reassurance. Ryder, what did you tell them? Just that you were alive. That you were here. His voice dropped. Callahan, these guys, they've been carrying this for 9 years. Dawes in particular. He stopped. Started again. He never stopped thinking about what happened on that road. I can't do this right now. I have patience. I know. I have a performance review situation happening and a supervisor who is looking for a reason. I know. I'm sorry. She hung up. Harold was watching her when she came back to the bedside. He was in his 70s and had the specific observational quality of a man who had lived long enough to see through most surfaces. You okay, sweetheart? I'm not your sweetheart, she said, but without heat. He grinned. Fair enough. Carry on. She finished the IV, documented it, moved to the next patient. This was what she did, kept moving, kept the work between herself and whatever was coming. She had done it after the convoy. She had done it through the months of surgeries and recovery and the particular grief of losing an identity so completely that she had to build a new one from scratch. She had become very good at forward motion as a survival strategy. But Dawes was landing in 40 minutes. She found out how bad it was going to be when Harlan appeared in the ER at 2:15. He wasn't alone. The man behind him was in his 50s, gray at the temples, with the bearing of someone who had spent a long time in a professional environment that rewarded certainty. Nora clocked him immediately as legal or administrative, the particular posture of someone who carried institutional weight and knew it. His name, she learned shortly, was Frank Adelson, and he was from the Regional Hospital Oversight Board, which meant Harlan had escalated something, though she couldn't yet tell what. She was between patients when they found her in the corridor. Harlan's expression was one she hadn't quite seen from him before. Not confident, exactly, but shored up, like a man who has brought reinforcements and feels better for it. Callahan, he said, this is Frank Adelson from the Regional Board. He has some questions. I'm between patients, she said. It'll be brief, Adelson said. His voice was neutral, the practice neutral of someone who did this professionally and didn't waste affect on it. All right. It's been reported, Adelson said, pulling out a small notebook, actual paper, which she noted, that you've represented yourself to members of this hospital's staff as having military medical training and credentials that may not appear in your employee file. She went very still. Who reported that? She said. The source isn't relevant at this time. It's relevant to me. Adelson glanced at Harlan, then back at her. Do you have military medical training? 7 years. 7 years of a rolled-down sleeve and a low voice and a carefully constructed nowhere in particular, and whatever Eli had told people had apparently moved faster than she'd understood. My employee file contains my nursing credentials and certifications, she said. Everything required for my position. That's not exactly an answer, Adelson said. It's the answer I have right now. Harlan stepped in, and she could see from his face that he had convinced himself of a narrative. People were like that. They got hold of a shape for something and they filled it in. Callahan, if you've been misrepresenting your background, I have never misrepresented anything to this hospital. Then explain why a veteran showed up at the front desk this morning asking for you by a name that isn't in your file. She looked at him. The corridor felt narrower than it had a moment ago. What name? She said. Doc, Harlan said, and in his mouth it sounded like an accusation. He asked for someone called Doc. She knew without asking that it was Dawes. She found him in the main lobby, sitting in one of the chairs near the information desk with his prosthetic leg extended in front of him and a paper coffee cup in both hands. He was 34 years old and looked older in the way that people who have been through specific things look older. Not worn out, exactly, but solidified, like something had burned away everything that wasn't essential. He saw her before she reached him. He stood up. The prosthetic didn't slow him. He was practiced, efficient. And for a moment he just looked at her the same way Eli had looked at her in the veterinary clinic, like a man performing a rapid recalibration of something he'd held as fixed. Callahan, he said. Dawes. She kept her voice quiet. The lobby wasn't crowded, but it wasn't empty. You didn't have to fly here. I know that. This isn't what Ryder told you, whatever he said. He said you were alive. Dawes set the coffee cup on the chair behind him. His voice was doing something she recognized, the particular tight control of someone who has a great deal of feeling about something and has decided that the lobby of a hospital in Denton, Virginia is not the place for it, but who is losing the battle slightly. That was enough. She looked at him for a moment, at the leg, at the lines in his face that weren't there in 2017. How are the kids? She said. Something shifted in his face. Good, he said. They're really good. A pause. I told them about you. Not everything, but about what happened, about who got us out. He stopped. Dawes. You carried me, he said. You carried me out of that vehicle with your arm on fire, Callahan. And then we all thought you were dead, and I... He stopped again, harder this time, pressed his jaw together. I needed to know you were okay. The lobby continued around them, the ambient noise of a hospital, the front desk staff, the automatic doors cycling. Normal sounds in a very abnormal moment. I'm okay, she said. I can see that. He looked around the hospital, the ER entrance, her scrubs. I can see that. She heard footsteps behind her and turned. Harlan was crossing the lobby with Adelson at his shoulder, and behind them was Marcus Webb, who had the expression of someone watching a situation develop faster than they can intercept it. Harlan took in Dawes, the prosthetic, the bearing, the coffee cup, and arrived at a reading that was visible on his face even from 10 feet away. Not compassion, calculation. A veteran with a visible injury, sitting in his lobby, asking for an employee who apparently had a background he hadn't vetted properly. Ms. Callahan, he said as he reached them, I need you to come with us. I'm speaking with someone, she said. I understand that. This is my colleague, she said. Give me 5 minutes. This is not a request. Stephen. Dawes' voice was quiet and very clear. He hadn't raised it. He didn't need to. He had the specific authority of a man who had spent years being the person others listened to when things went bad, and even standing in a hospital lobby on a prosthetic leg holding a paper coffee cup, that authority was fully intact. Her name is Sergeant First Class Nora Callahan, and before she was your nurse, she was the combat medic who ran back into a burning convoy 3 times to pull people out, including me. He looked at Harlan without any particular hostility, just directness, which was somehow more effective. So whatever you need, it can wait 5 minutes. Harlan opened his mouth, closed it. Adelson made a small note in his notebook. Marcus Webb stood 2 steps behind both of them and looked like a man who had just watched something fall into place that he had been waiting to understand. Harlan said, "This doesn't change the situation with your employment review." "No," Nora said. "I didn't think it would." He turned and walked back toward his office. Adelson followed. Marcus didn't. Nora looked at her charge nurse for a moment. He looked back at her. "Sergeant First Class," he said quietly. She didn't respond to that. 7 years, he said. "Marcus, 7 years you've been in my ER." He shook his head once, not with judgment, with something that looked more like the specific exhaustion of realizing you'd been wrong about something in a way that mattered. "Okay, we'll talk later." He walked back toward the ER. Nora turned back to Dawes. He was watching Harlan's retreating back with a look she recognized. Not anger, but assessment. The way a soldier looks at a problem and starts working out how to move around it. "He's going to fire you," Dawes said. "He's going to try." "That's not going to happen." He picked up the coffee cup. "Vargas is driving up from Richmond. Obi's on a train from Baltimore. Pelham—" He paused. "Pelham actually got on a plane from Colorado." Nora stared at him. "Ryder made 1 call," Dawes said. "That's all it took." He looked at her directly. "We thought you were dead, Callahan. You don't get to be surprised that we're here." She stood in the lobby of her hospital with the sounds of the ER behind her and the morning light coming through the front windows, and 4 combat veterans either in the building or on their way to it, and felt something she hadn't felt in 7 years. The particular disorienting sensation of not being alone in a way she hadn't chosen and couldn't reverse. Ghost wasn't here, but Eli was. She could see him now through the front glass, standing on the sidewalk outside with his hands in his jacket pockets, watching the entrance. She turned back to Dawes. "If Harlan finds out why you're all here—" "Good," Dawes said simply. "Let him." And behind him, through the glass, she saw Eli take his phone out and make a call. Whatever he was setting in motion, it had already started. Eli's call lasted 4 minutes. Nora knew this because she counted. An old habit, the kind of thing you do when you're standing in a situation you can't control and your brain needs something to measure. She watched him through the glass, his back half turned to the entrance, one hand in his jacket pocket and the other holding the phone flat against his ear. He didn't pace, didn't gesture, just stood there in the cold morning light and talked to someone, and when he was done, he put the phone away and stood for another moment looking at the street. Then he came inside. Dawes was still beside her. Neither of them spoke while Eli crossed the lobby. "That was Obi," Eli said when he reached them. "He's got 2 hours until his train. He's making a call first." "To who?" Nora said. "His JAG contact at Fort Meade." The word landed with a specific weight. JAG, Judge Advocate General, Military Legal. The moment that word entered the conversation, something shifted. The situation stopped being personal and started being institutional, which was an entirely different kind of problem. "No," Nora said. "Callahan, I said no. Nobody is contacting JAG. Nobody is contacting anyone official. This is not what I want." "I know what you want," Eli said, and his voice was patient but not soft. "You want to be left alone in a hospital where a man is about to fire you for saving a patient's life, and you want everyone to pretend that's fine because the alternative involves people knowing who you actually are." He paused. "Is that a fair summary?" She didn't answer. "Obi's not filing anything," Eli said. "He's asking a question. 1 question to 1 person off the record. That's it." Dawes had his coffee cup again and was looking at the middle distance with the studied neutrality of a man who has decided this particular argument is not his to have. Nora looked at Eli for a long moment. The lobby moved around them, an orderly with a wheelchair, 2 visitors following signs toward radiology, the front desk rotating through a shift change. Normal motion in a place that was becoming very complicated very fast. "1 question," she said. "1 question." She walked back into the ER. The afternoon was this kind of busy that didn't allow for thinking, which was the only thing that made it survivable. She had a 40-year-old with a suspected MI who presented atypically, fatigue and jaw pain rather than chest pressure, the kind of presentation that got missed by people who only looked for what they expected to see. Nora caught it, pushed for the troponin levels immediately, had the patient in a monitored bay before the attending arrived. Dr. Pruitt signed off on the order set without comment, which was the closest he got to acknowledgement, and Nora documented everything and moved on. She had a pediatric laceration, 2 sutures, a child who screamed for exactly 30 seconds, and then became deeply interested in the ceiling tiles. She had a woman with a dislocated shoulder who refused pain medication on principle and whom Nora reduced efficiently and without ceremony, which was what the woman seemed to want. She had a diabetic patient in early DKA who needed fluids and monitoring and a conversation, slow, careful, about what her numbers had been doing for the past 2 weeks and why. She did all of it. Between patients, she could see the lobby from the ER entrance. At some point in the early afternoon, Vargas arrived. She recognized the posture before she recognized the face. A compact man in his early 40s with a deliberate way of moving that she associated with someone who had spent years being careful in environments where carelessness had consequences. He embraced Dawes, spoke briefly with Eli, and then all 3 of them settled in the lobby with the particular patience of people who have been trained to wait. Marcus passed her in the corridor at 2:30. "There are now 4 veterans in our lobby," he said, conversationally. "I know. Pelham landed. He's got a rental car." She looked at him. "I checked the flight app," Marcus said without inflection. "It's a thing I do." He kept walking, then over his shoulder. "For what it's worth, I pulled your outcomes data this morning, ran it against the ER average for the last 3 years." He didn't stop. "You might want a copy of that." She stared after him. "What?" Harlan moved at 4 o'clock. Nora was in the middle of a documentation cycle when Judith Crane appeared again, this time without the notepad, which was either better or worse. She couldn't immediately tell which. The HR director's expression had moved from rehearsed neutrality into something that looked genuinely uncomfortable. "Dr. Harlan would like to meet with you now," she said. "I have 2 more patients. He asked that it be now." The ER charge desk was right there. Marcus was 2 feet away, doing his own documentation, and he was very carefully not looking at either of them. Nora set down her tablet, told the next patient through the triage nurse that she'd be back in 15 minutes, and followed Judith Crane. The conference room was larger than Harlan's office. A deliberate choice, she noted, the kind of spatial decision that people made when they wanted a setting that felt formal and final. Harlan was there, and Adelson from the board, and a third person she hadn't seen before. A woman in her 50s with reading glasses pushed up on her head and a laptop open in front of her. Nora didn't know her, but the laptop and the position at the table told her, documentation, official record. "Sit down, Ms. Callahan," Harlan said. She sat. "We've spent the afternoon reviewing your personnel file and the circumstances of your hire 3 years ago." He opened a folder, an actual paper folder, which told her this had been assembled in advance. "There are some inconsistencies we'd like to discuss." "What inconsistencies?" she said. "Your application identified your prior work history as civilian nursing positions in Northern Virginia and Maryland. There's no mention of military service. The application asked for relevant civilian employment history. It asked for a complete work history. I completed the fields as directed." Adelson leaned forward slightly. "Ms. Callahan, were you or were you not a member of the United States Army?" The room was quiet. She had known this moment was coming from the second ghost pressed his muzzle against her arm in that veterinary clinic lobby. She had known it with the specific clarity of someone who has outrun something for a very long time and can feel the gap closing. She had 7 years of practice at deflection and redirection and strategic omission, and she looked at the faces around that table and understood that none of those tools were going to work in this room, today, with this much already in motion. "Yes," she said. Harlan's posture changed. Not surprise, he'd suspected this, but a particular settling, the look of a man who has been vindicated in a suspicion and is not going to let the moment go unnoticed. "And you chose not to disclose this," he said. I wasn't required to disclose it. For a position in our ER, with the kind of scope of practice decisions you've been making, My scope of practice decisions are within nursing guidelines. My military history is irrelevant to that. It's relevant, he said, to whether we can trust your judgment about what falls within your scope. He closed the folder. There are veterans in our lobby right now who are here on your behalf. One of them used a military rank when addressing you this morning in front of my staff. You have a background you deliberately concealed. You have a pattern of overriding physician decisions, and you have people with military credentials showing up at my hospital. This is a serious situation, Ms. Callahan. Those are 4 unrelated facts you're presenting as a pattern, she said. I'm presenting the totality of the picture. The totality of the picture is that I've been an exceptional nurse for 3 years in this ER, and you're looking for a way to frame that as a liability. Harlan looked at her. Then he looked at Judith Crane and gave the small, deliberate nod of a man who has already made his decision and is now executing the procedural part of it. Pending a full review of your hiring documentation, you'll be placed on administrative leave effective immediately. You'll receive written notice by end of day. The woman with the laptop was typing. Nora looked at her hands on the table for a moment, at the sleeve rolled down over the scars, at the hospital ID badge clipped to her scrub pocket that said, Callahan, Nora, RN. Understood, she said. Just that. She stood, pushed the chair back in, a small automatic courtesy that she recognized as absurd under the circumstances, and did anyway, and walked out. The lobby had changed. Pelham had arrived while she was in the conference room, which meant the group near the window now numbered 5. Eli, Dawes, Vargas, Obi, a quiet man with a measured face and a cardboard coffee tray, and Pelham, who was larger than she remembered, broader through the shoulders, with gray at his temples that hadn't been there in 2017. They all saw her come through the ER door. None of them said anything. They didn't have to. Her expression told them enough, and they were all people who had learned to read faces in environments where misreading them had costs. It was Pelham who moved first, crossing the lobby in a way that was neither fast nor slow, just purposeful. He stopped in front of her and looked at her the way you look at someone you've replayed a memory of for 9 years and are now recalibrating against the real thing. Sergeant Callahan, he said. Pelham. She looked up at him. You didn't need to fly from Colorado. Yes, I did, he said, with the finality of a man who has already settled this question internally and doesn't need to revisit it. She stood there for a moment with all 5 of them around her and felt something she genuinely didn't have a category for. Not comfort, exactly, and not relief, and not the complicated grief of the lobby the night before. Something closer to the specific sensation of a structure that has been holding a great deal of weight for a very long time, suddenly having some of that weight distributed elsewhere. She didn't know what to do with it, so she said, They put me on leave. The group took this in without visible reaction, which was itself a reaction. The particular stillness of people who have received bad news before and know that the first 30 seconds after are for absorbing, not responding. Then Obi said, Can we use that conference room? They didn't use the conference room. Marcus Webb, displaying a quality of situational awareness that Nora was going to owe him for significantly, redirected the group to the family consultation room off the ER waiting area, a small, quiet space with chairs and a table and a door that closed. He didn't ask any questions. He just pointed them toward it and walked away. 6 people in a room built for 4. Ghost wasn't there. Eli had left him with the neighbor that morning, given the shoulder injury, but the absence of the dog somehow made the room feel more serious, not less. Nora sat at one end of the table. The rest of them arranged themselves with the unconscious spatial efficiency of people who had spent years operating in close quarters. Obi set the coffee tray on the table and opened his phone. My contact at JAG is Hendricks. He and I served together before he went legal. He's not in an official capacity right now. This is off the record. Personal. He looked at Nora. I told him you were here. I didn't tell him anything else. What did he say? She said. He said he needed to know if you were separated under normal terms or if there were issues with your service record. Normal terms, she said. Medical separation. Bilateral burn injuries, left arm and shoulder, secondary infection that ran long. I was out in 8 months. Obi nodded and typed something. Pelham leaned forward. Harlan doesn't know what he's looking at. He thinks he found something, some discrepancy in your file, and he's running with it because it gives him cover for what he was already planning to do. I know what he's doing, Nora said. Then you know it's not going to stop at administrative leave, Vargas said. I was sitting with his arms crossed, his voice flat and practical. He'll push for termination. And once he's got that in your record, the next hospital that calls for a reference, I know, she said again. So we need to move first, Eli said. She looked at him. What does that mean? He glanced at Obi. Obi said, Hendricks asked whether your service records were accessible. I told him I didn't know. He said if they are, and if your record is what I described. He paused, and in the pause there was the specific weight of a man choosing his words carefully. Then what Harlan is calling an inconsistency is actually a protected disclosure situation. You didn't omit military service to deceive. You separated under medical terms, you rebuilt a civilian career, and you had no legal obligation to foreground that history in a standard nursing application. That's not, Nora started, that's not the whole thing, Obi said. The second part is that Harlan's review of your hiring documentation, specifically the way he's framing your concealed background as a basis for questioning your clinical judgment. Hendricks said that depending on the language he used in that meeting today, it may constitute targeting of a veteran employee on the basis of service-connected medical history. The room was quiet. Nora looked at the table, at the rings left by the coffee cups, at her own hands. The scars, she said. He's made comments, Obi said quietly. In the meeting, he referenced your judgment being related to your background. If he's connected your medical separation, the burn injuries, to questions about your clinical stability, that's a specific kind of problem for him. She thought about what Marcus had said, about pulling her outcomes data. She thought about Judith Crane's uncomfortable expression in the hallway. She thought about the woman with the laptop typing everything down in that conference room, and whether that documentation was going to protect Harlan or undo him. Pelham said, "We also have the records." Everyone looked at him. He reached into the bag he'd carried from Colorado and put a folder on the table. It wasn't large, but it was real. Printed documents, some of them old enough that the paper had a particular quality, government issue, and on top was a photograph Nora hadn't seen in 9 years. She recognized the convoy site from the angle of the light more than from the geography. The burning vehicle, the road, the specific dark that came from smoke layered over dust. She didn't reach for it. Your commendations are in there, Pelham said. The evacuation report, the casualty summary with annotations from the field medic assessment, which was you, so it's in your own handwriting. He paused. And there's the formal acknowledgement of your service that got filed at separation. It's signed by Colonel Ramirez. Why do you have all of that, she said. Because Dawes requested copies through the official access process 18 months ago, Pelham said. He glanced at Dawes. Dawes was looking at his coffee cup. I filed for them when I started the VA claim for the leg. They were part of the incident documentation. He looked up. I've been carrying them since then. I didn't know what I was going to do with them. The room absorbed that. Nora finally looked at the photograph. She picked it up, held it in both hands, the scarred one and the good one, and looked at it for a long moment. The road, the vehicles, the specific quality of the light at that hour. She had not seen this image before. She had lived it, which was different. Seeing it from outside was different. She set it down. Okay, she said. Everyone waited. I don't want to be the story. I want to work. I want to go back to my ER and do my job, and I want Harlan to stop. She searched for the word, inventing reasons to push me out. That's not going to happen with things as they are, Eli said. I know that. She pressed her palm flat on the table. So what are you suggesting? Obi said, Hendricks comes down. He talks to the board, not as a lawyer, as someone with information relevant to an ongoing employment review. He presents the records as context. He doesn't file anything. He doesn't threaten anything. He just makes sure the people making decisions about your career understand what they're looking at. And if Harlan pushes back? Then we have a conversation about next steps, Obi said. But my read is that he won't. When a man who's been framing someone's military history as a liability finds out that that history includes a formal Army commendation and signed documentation of a combat evacuation, his position changes fast. Vargas nodded. Pelham said nothing, but his expression said enough. Nora sat back in her chair. Outside the consultation room, through the thin wall, she could hear the ER moving, The overhead page, the wheels of a gurney, the low constant noise of a place that didn't stop for anyone's personal crisis. She had spent 3 years building her life into the rhythm of that noise, had spent 7 years rebuilding a self that could function inside a structure, carry a caseload, be useful without being known. She thought about Harlan's face in that conference room, the settled satisfaction of a man who believes he's found leverage. She thought about Ghost pressing his trembling weight against her leg in a veterinary clinic lobby at night, and the 9 years that animal had been carrying the smell of someone the world had filed as gone. "Call Hendricks," she said. Marcus found her at the medication cart an hour later. She wasn't supposed to be on duty, administrative leave meant off the floor, but Marcus had a particular interpretation of administrative leave that involved being in the building without active patient contact, which was technically compliant if you didn't look at it too hard. He stood beside her without asking why she was there, because he already knew. "Harlan got a call from the board," he said quietly. She looked up. "About 30 minutes ago." Whoever it was brief. Harlan came back from it and went directly into a closed-door session with Adelson. Marcus paused. He didn't look like a man who'd gotten good news. She set down the medication documentation sheet. "Did you actually pull my outcomes data this morning?" "Yes." "And?" "Your MI catch rate is 23% above the ER median for atypical presentations. Your documentation audit rate, meaning errors that got flagged in review, is the lowest on the floor by a significant margin." He crossed his arms. "The Ellison case, the one Pruitt was upset about. I pulled the imaging report. 26 minutes earlier than standard protocol resulted in a reduction in estimated permanent deficit of approximately 40%. She looked at him. "I put it in a memo," he said, "addressed to Judith Crane and CC'd to Adelson, about 2 hours ago." He shrugged, a small motion. "Just thought it was relevant context." "Marcus?" "Don't thank me," he said. "I don't need it. He stopped, seemed to reassemble what he was going to say into something more honest. "I've worked with a lot of nurses over 20 years. Good ones and bad ones, and ones who were good and didn't know it, and ones who were mediocre and did." He looked at her directly. "I knew you were exceptional in the first 6 months. I didn't know what the rest of the shape was. But I knew that." He uncrossed his arms. "So." He picked up the documentation sheet she'd put down. "Go sit somewhere. Let it work." At 6:15, Stephen Harlan walked out of his closed-door session and down the main corridor with the posture of a man who was managing something. Nora was in the family consultation room. Eli had gone to retrieve Ghost from his neighbor. The dog's shoulder was wrapped and he was restricted from stairs. But nobody had said anything about lobbies, and the rest of them were either sitting or standing in the small room with the quality of people who have been through enough to know how to hold a space without filling it unnecessarily. The knock on the door was Judith Crane. She opened it without waiting for an answer, which told Nora something about what was happening. Behind her was Adelson, and behind Adelson was a man Nora didn't recognize. Late 50s, civilian clothes, but posture that read unmistakably as either military or former, a face that was professional and gave away almost nothing. Judith Crane looked at the group in the room, the veterans, the folder on the table, Nora, and made a decision that was visible in her face, a shift from procedural to human, small but real. "Miss Callahan," she said, "this is Mr. Terrence Whitfield. He's a member of the Regional Board's Oversight Committee and a former—" "I can introduce myself," Whitfield said. His voice was even, with the particular economy of language that came from a long time spent in environments where words cost something. He looked at Nora. "Staff Sergeant Whitfield, retired. 21 years, Army Logistics and Special Operations Support." He extended his hand. She shook it. "I've been briefed on your situation," he said, "and I've reviewed the documentation your colleagues provided." He glanced at the folder on the table, Pelham's folder, and back at her. "I have some concerns about the way this review has been conducted," Adelson said. "Terrence." "I have some concerns," Whitfield repeated without raising his voice, which was more effective than raising it would have been. He looked at Nora. "Miss Callahan, I'd like to ask you something, and I'd like you to answer it honestly." "All right," she said. "The decision-making you exercised in the cases that Dr. Harlan cited, the Ellison case and the case in Trauma Bay 3, were those decisions made on the basis of your nursing training, your military medical training, or both?" She considered it. Both, she said. I can't separate them. They're the same instinct at this point. He nodded. That's what I thought. He turned to Adelson. That's what makes this complicated. Not in the way Harlan thinks. In the opposite direction. He turned back to the room. Ms. Callahan, the board is going to conduct a full review of your hire and your employment file. Not as a punitive action. He looked briefly at Adelson. As a corrective one. Your administrative leave is being suspended pending that review. Judith Crane had her notepad now, the one she hadn't brought to the earlier meeting. She was writing. What about Harlan? Eli said from the corner. Whitfield looked at him. That's an internal matter. It's also a pattern, Eli said. Callahan isn't the first. The room went quiet. Whitfield's expression changed slightly. Not surprise. Something more like a man who has had a suspicion confirmed and doesn't enjoy being right. What do you mean by that? Eli looked at Nora. She looked at him. And she thought about Marcus's comment, not the first, and the way Judith Crane had looked uncomfortable in the hallway before any of this started, before the veterans, before Whitfield. Uncomfortable like someone who already knew things. Judith, Nora said. The HR director looked up from her notepad. How many performance improvement plans has Harlan initiated in the last 3 years? Nora said. Judith Crane's pen stopped moving. How many of them were ER staff? Nora continued. Specifically nursing staff who had raised concerns about attending physician decisions? Judith was quiet for 4 seconds. Then she closed her notepad. She reached into the folder she'd been carrying the whole time, the folder Nora had assumed contained standard HR documentation, and placed a printed summary on the table. 11 pages. Whitfield looked at it, then at Judith Crane. I've been compiling this since January, Judith said quietly. 6 cases, 4 nursing staff, 2 physician assistants, all initiated by Harlan within 30 days of a documented escalation above and attending. She paused. I didn't have a mechanism to raise it. I needed something that would make it visible. She looked at Nora. Nora looked back at the 11 pages on the table and at Judith Crane's expression and understood that the discomfort in the hallway that morning had not been reluctance. It had been recognition. It had been a woman waiting for the right moment, and the right moment had just arrived in the form of 5 combat veterans and a retired Army logistics sergeant on the Regional Oversight Board. Whitfield picked up the 11 pages. The room was very quiet. Then his phone buzzed. He looked at it, and something moved across his face. Not alarm, but urgency. He looked at Nora. Is there a veterinarian on call in this hospital? He said. The question was so wrong for the moment that it took her a beat to process it. No, she said. This is a human hospital. The nearest animal emergency is Alderman Street, 20 minutes. Whitfield turned his phone so she could see the screen. It was a text from Eli, who had left 40 minutes ago to retrieve Ghost. 4 words. Clinic now, Ghost down. She was moving before she finished reading the text. Not running. The lobby wasn't a place for running, and she had enough years of emergency response in her body that panic had long since been replaced by a kind of accelerated precision, every unnecessary motion stripped away and only the functional remaining. She told Dawes where she was going in 4 words. She grabbed her jacket from the consultation room chair. She was through the lobby doors in the time it took Whitfield to read the text twice. Pelham caught up with her in the parking structure. She didn't tell him to stay behind, partly because there wasn't time, and partly because she already understood that telling these men to stay behind was not a thing that worked. He drove. She sat in the passenger seat and called Eli. He picked up on the first ring. What happened? She said. He was fine when I got there. He ate, he was calm, the shoulder seemed okay. Eli's voice had the controlled quality of someone managing a situation and managing himself simultaneously, which she recognized because she did the same thing. Then about 20 minutes ago, he just went down, front legs first, then the rest of him. His breathing's wrong, fast and shallow. Dr. Finch is with him now. Internal? She said. That's what Finch thinks. He's talking about the spleen. Splenic hemorrhage in an aging large breed dog was one of those things that moved fast when it moved. She'd seen the equivalent in human trauma, the organ that held pressure until it didn't, the patient who looked stable right up until the moment they weren't. She knew the window. How long has he been down? She said. Maybe 25 minutes from the first signs. I didn't clock it exactly. Tell Finch she needs a pressure reading now if she doesn't have one, and tell her I'm 12 minutes out. She hung up. Pelham was driving the way people drove when they understood what 12 minutes meant. The shoulder wrap, she said half to herself. The restricted activity. He was calm, but he was a dog in a small space with an injury. Something shifted. You think he was masking it? Pelham said. Military working dogs mask, she said. It's bred into them. They don't display distress in ways that read as distress. They work until they can't. She looked out the window at the city moving past. Same problem as treating veterans in a civilian ER. You have to read what isn't being said. Pelham didn't respond to that. He didn't need to. The Alderman Street Clinic looked different at dusk than it had at night 2 days ago. Smaller, somehow, the parking lot halved by shadow. Eli was outside the entrance when they pulled in, standing the way people stood when standing was the only available action. Not still exactly, just held. He had his phone in his hand and he was looking at the door. He saw Nora come out of the car, and something in his posture changed, the particular release of a person who has been alone in a bad situation and is no longer alone in it. Finch has him on the table, he said. She got the pressure reading. It's low. She's talking about whether she can operate. Does she have a surgeon? Her regular is in Richmond. She's trying to reach someone from the emergency vet network. Nora pushed through the door. The clinic was different in the evening. The day staff gone, the lights lower in the waiting area, the sound of the building reduced to its mechanical minimum. Delia was at the desk, and she stood immediately when Nora came in. Behind the reception area, through the door to the treatment rooms, there were sounds. Movement, equipment, the specific clipped exchange of people working against a clock. She's in two, Delia said. Nora went through. Dr. Finch was a tired-looking man in his 50s under normal circumstances. Right now he looked like a man who had made 2 phone calls that hadn't gone the way he needed them to. Ghost was on the stainless table, big, silver-muzzled, still, with monitoring leads attached and an IV line in his left foreleg, and the particular flatness of an animal that has crossed from conscious distress into the gray zone where the body is conserving everything it has left. Callahan, Finch said, which was all the greeting either of them needed. She went to the table, placed her hand against Ghost's flank, felt the respiration, too fast, too shallow, the belly doing more work than the chest, which meant the diaphragm was being pressured from underneath. She checked his gum color, pale. Not white, not yet, but heading that direction with purpose. What's his pressure? She said. 82/50 when I last ran it. That was 4 minutes ago. Finch had a printout of the imaging in his hand, portable ultrasound, the image grainy but clear enough. He showed her. Fluid in the abdomen. I think it's the spleen. He's been on the meloxicam for the shoulder, which I didn't know about until Ryder told me 15 minutes ago, and the NSAID could have thinned the clotting response, she said. Yes. Can you operate? Not alone. Not on a dog this size with this presentation. He set down the printout. I can stabilize him. Fluids, monitoring, pressure support. But if it's a splenic rupture, he needs surgical intervention and he needs it in the next, he checked the monitor, probably 90 minutes before we're in a different conversation. Nora looked at Ghost. The dog's eyes were open, which was the thing that was making this harder than it would have been if they weren't. He was looking at the ceiling, or at nothing. It was hard to tell with dogs. They weren't built to signal suffering the same way, but his peripheral vision caught her movement and his eyes moved to her face and stayed there. Stay, she said quietly. Just the one word. His tail moved, fractional, but it moved. She turned to Finch. Your surgical network. What's the response time if you flag it as emergency? 30 to 60 minutes, depending on who picks up. Flag it now. Flag it as critical. And while you're doing that, she was already pulling on a pair of gloves from the rack on the wall. Walk me through your fluid protocol and tell me what you have for pressure support, because 82/50 is going to keep dropping, and we're not going to wait 60 minutes to start responding to it. Finch looked at her for a brief moment. Not resistance, assessment. He was deciding whether she was someone who understood the situation or someone who was going to make it worse, and he was doing it fast because fast was what they had. I have saline and hetastarch, he said, reaching for his phone. And I've got dopamine if we need to go there. Start the hetastarch, she said. Slower than you think. If it's a rupture, we don't want to raise the pressure too fast, or we blow whatever's clotted. He was already dialing. I know, he said, but not dismissively, with the tone of a man who is glad someone else in the room also knows. Eli appeared in the doorway. He saw Ghost on the table and Ghost's eyes tracking to Nora, and he stopped there, one hand on the doorframe, and didn't come further in. Some spaces you stayed out of when work was happening in them. Is he? Eli started. Working on it, Nora said. Stay out there. He stayed out there. The next 40 minutes were the kind that compressed and stretched simultaneously, the way time moved in emergency situations, individual seconds endless, the aggregate gone before you could account for it. The head of starch went in slowly. Ghost's pressure stabilized at 86, which was not good but was not worse, which under the circumstances counted. Nora monitored his respiration, his gum color, his capillary refill time, the same battery of checks she would have run on a human patient with internal bleeding, translated across species with the specific adjustments her brain made automatically, the product of years of treating people in conditions that didn't allow for the full weight of institutional medicine. You learned to read what you had. You learned to work with what was in front of you. Finch got through to a surgical veterinarian named Dr. Eiko Sorensen on his third call. She was 45 minutes out. She asked the right questions in the right order, which told Nora something about her. Her voice on the speakerphone was steady and specific, and she didn't spend time on preamble. Keep him under 60 on the systolic if you can, Sorensen said. If it's the spleen and it's actively bleeding, you don't want a pressure spike. We know, Nora said. A brief pause. Who's that? ER trauma nurse, Finch said. She's been managing the pressure protocol. Human ER? Yes, Nora said. Another pause, shorter. Okay, I'll be there in 40. She made it in 37. Dr. Eiko Sorensen was a compact Japanese-American woman in her late 40s who arrived in scrubs she'd clearly already been wearing when she got the call and operated with the brisk, unhurried efficiency of someone who did not have the bandwidth for unnecessary communication. She assessed Ghost in under 2 minutes, confirmed the working diagnosis, and began prep for exploratory surgery while still asking Finch questions she simultaneously answered herself based on what she was finding. She looked at the pressure log Nora had been keeping, handwritten, time-stamped, on the back of a supply inventory sheet because nothing else was available. This your work? She said. Yes, Nora said. Sorensen looked at the log for about 4 seconds. Good call on the slow infusion. If you'd run it at standard rate, he'd have blown the clot 20 minutes ago. She handed the sheet back. I'll need the room. Nora went out. The waiting area had accumulated people in the way that the clinics accumulated people during emergencies. Not a crowd, but a presence. Eli was in a chair with his elbows on his knees. Pelham was standing near the window. Dawes had appeared at some point. She hadn't seen him arrive, and was sitting with his prosthetic extended and his hands folded and his face set in the particular patience of a man who had waited in bad situations before and understood that waiting was itself a form of work. She sat down. Nobody said anything for a while. Then Eli said, He's been with me 9 years. I know, she said. He's not supposed to... He stopped. Started differently. He's 14. That's old for a shepherd. I knew this was coming sometime. Sorensen's good, Nora said. She moved fast and she asked the right questions. She paused. He's not gone yet, Ryder. He nodded, stared at the floor. Pelham's phone buzzed. He looked at it and crossed toward Nora. It's Obi, he said quietly. From the hospital. She took the phone. Obi's voice was low and clipped in the way of someone delivering information in a space where they couldn't be overheard. Whitfield called for an emergency board session 20 minutes ago. Harlan was notified 20 minutes after that. I'm told the meeting is tonight, 7:30. What's on the agenda? Officially, it's a review of HR practices in the ER division. A brief pause. Unofficially, and Whitfield told me this directly, Judith Crane submitted her 11-page compilation formally this afternoon, into the board record, not as a memo, as an official complaint. Nora absorbed this. There's more, Obi said. Adelson asked me about the meeting in the consultation room, specifically about what Judith said about the pattern of PIPs. He asked whether the veterans who came to the hospital today would be willing to provide statements. What kind of statements? Character statements, service documentation, context for what the board is calling an anomalous pattern of performance management actions against ER staff who raised clinical escalation concerns. She looked at Eli across the waiting room, at Dawes, at Pelham in the window. Tell Adelson yes, she said. Tell him I'll let the others know. She handed the phone back to Pelham and told him what Obi had said. He took it in without visible reaction, nodded once, and moved toward Dawes. She watched them talk in low voices, the particular efficiency of people who are accustomed to receiving information and determining action without a great deal of ceremony. Eli was watching her. Go, he said. I've got him. I'm not leaving while Ghost's in surgery. Callahan. I'm not leaving, she said again flatly, and that was the end of that conversation. Sorensen emerged at 9:14. She was still in her surgical cap, mask pulled down, with the expression of a woman who had worked hard and was not going to perform more drama than the situation required. She looked at Eli first because he was the handler and therefore the primary. It was the spleen, she said, partial tear, which is why he held as long as he did. We removed it. The bleeding's controlled. He's stable and he's coming out of anesthesia. She paused. He's 14. The surgery was invasive and his recovery is going to be slow and he's going to need consistent management going forward. But he's through it. Eli pressed his palm flat against his forehead and stayed like that for a moment. Can I see him? He said. Give us 15 minutes, Sorensen said. She looked at Nora. The pressure management saved him time, she said. If his pressure had spiked before I got here. She didn't finish the sentence because the end of it was apparent. Good call. Thank you, Nora said. Sorensen went back through the door. Eli stood up and walked to the window and looked out at the parking lot for a while. Nora sat where she was. Dawes had his eyes closed. Pelham was on his phone again. She could see from his expression that it was Obi, that something else was developing at the hospital, but she let it go for the moment. 15 minutes. She could have 15 minutes. She looked at her hands in her lap, at the scarred one and the good one. She had used both of them tonight. The good one for the IV line, the scarred one to check Ghost's respiration, pressing the palm against his flank to feel what the monitor numbers meant in physical terms. The scarring had some nerve damage, less sensitivity in the fingertips, but more than enough for what she'd needed. She had stopped thinking of the scars as damage a long time ago, or she had tried to. There were still mornings when she caught them in the bathroom mirror and felt the particular heaviness of everything they represented. Not the injury itself, but the before and after of it, the life on the other side of that road. Tonight, they had done work. That was enough. When Sorensen let Eli in to see Ghost, Nora stayed in the waiting room. She didn't need to be in there. She had done what she could do, and the rest of it belonged to the man and his dog. And she understood the difference between being useful and being present for her own sake. Pelham sat down across from her. He was quiet for a moment, the way he was often quiet. Not uncomfortably, just waiting to see if silence was the right tool for the moment, or if something else was needed. Obi's at the board meeting, he said finally. Already? Whitfield moved the time up, 6:30 instead of 7:30. He set his phone on the chair beside him. Harlan was there. They started with Judith's documentation. Then Adelson presented the outcomes data Marcus compiled. She was quiet. Harlan tried to reframe it, Pelham said. Told them the PIPs were individually justified, that the pattern was coincidence. He paused. Then Whitfield asked him about the conversation in the conference room this afternoon, specifically the language he used about your background and your judgment and whether the two were connected. And Harlan said, Pelham picked up his phone, looked at it, reading, that an employee with undisclosed service-connected injuries had, in his professional estimation, demonstrated clinical instability consistent with post-trauma presentation, and that his performance management actions were a response to that assessment. The waiting room was quiet enough that she could hear the ventilation system. She said, he put that in a board meeting. On the record, Pelham said, with the documentation team present. He set the phone down. Obi said Whitfield's expression didn't change. He just wrote something down, and then the board chair, a woman named Ferris, asked Harlan whether he had any clinical qualification to make a post-trauma assessment of an employee. He doesn't, Nora said. Harlan said he'd been in hospital administration for 22 years. That's not the same thing. No, Pelham said. It isn't. He looked at her directly. Ferris then read into the record your 3-year outcomes data, your commendations, and the Army evacuation citation from Pelham's folder, which Whitfield had submitted as supporting documentation at the start of the meeting. She stared at him. Your formal commendation was read into the record of a regional hospital board meeting, Pelham said. Tonight, in front of Harlan. He paused. Obi said Harlan asked to take a recess about halfway through. Did they give him one? No. Nora sat back in her chair. She had spent 7 years being careful. 7 years of rolled sleeves and strategic omission and the particular discipline of never being the most visible person in any room. She had built a life on the premise that the past stayed where you put it, that the distance between who you were and who you were now could be maintained with enough consistency and enough time. 2 days ago, a dog had pressed his muzzle against her arm and started unraveling all of it. And somehow the unraveling had ended up with her commendation being read aloud in a board meeting she wasn't even in. Pelham's phone buzzed. He looked at it. Something changed in his face. A small shift, controlled, but there. What? She said. He looked up. Obi says the board chair asked Harlan about 2 specific former employees. A physician assistant named Reyes, who left 18 months ago after a PIP, and a nurse named Carver, who filed a grievance that was closed without action about a year before that. She waited. Both of them, Pelham said carefully, filed their initial concerns after escalating clinical decisions above an attending physician. Both PIPs were initiated by Harlan within 3 weeks. He paused. Reyes left the profession. Carver is in Minnesota at a smaller facility, took a pay cut. Nora absorbed this. Judith had both of them in the 11 pages, Pelham said. I know. Ferris just asked Harlan whether he had documentation showing the clinical basis for either of those PIPs. And? Pelham set the phone down. He asked for a recess again, he said. The air in the waiting room felt different. Not lighter. She wasn't going to call it that because there were still too many open threads, too much that hadn't resolved, too many people who had lost things that couldn't be given back. Reyes had left the profession. Carver was in Minnesota at a smaller facility. Those were real costs that had nothing to do with tonight. But something was shifting. She could feel it the way you felt a change in pressure before the weather changed. Not the change itself, just the signal that it was coming. She was still sitting there, working through it, when Eli came back from the surgery suite. He looked different. Not lighter either. More settled, maybe. The particular quality of a person who has been holding something suspended and has just found out which way it's going to fall. He sat down beside her without preamble. He's going to make it, he said. I know. He woke up and looked for you, Eli said. He said it matter-of-factly, not as sentiment, just as a report of what had happened. Not for me. For you. She didn't answer. I told him you were here, Eli said. He closed his eyes again after that. He was quiet for a moment. I know that's a dog thing and probably doesn't mean. It means something, she said. Just that. He nodded, looked at the floor, and then her own phone buzzed. She looked at the screen. It was a number she didn't recognize, Virginia area code, not Denton. She almost let it go to voicemail. Then she answered. The voice on the other end was male, professional, carrying the specific cadence of someone who chose their words with institutional care. He introduced himself as Douglas Farr, legal counsel for Hargrove Regional Medical Center, calling on behalf of the board of directors. Ms. Callahan, he said, I've been asked to inform you that effective immediately, Dr. Stephen Harlan has been placed on administrative suspension pending a full board inquiry. Your administrative leave has been rescinded, and the board would like to schedule a meeting with you at your earliest convenience to discuss. She was listening, but she was also watching Eli across the small space of the waiting room, and Dawes with his eyes still closed, and Pelham setting down his phone, and through the door behind reception, the sound of a clinic settling back into quiet after the emergency had passed. Farr was still talking. He was using words like remediation and structural review and commitment to staff protection. And she was absorbing all of it, filing it in the part of her brain that processed institutional language and translated it into what it actually meant. What it actually meant was, Harlan's position had become indefensible. What it actually meant was, the 11 pages, the outcomes data, the commendation read into the record, the 2 veterans named Reyes and Carver who had lost things. All of it had weight that exceeded whatever Harlan had built his confidence on. What it actually meant was the board was trying to get ahead of something they could see coming. "Mr. Farr," she said when he reached a natural pause. "Yes, Ms. Callahan." "I'll come in tomorrow morning," she paused. "I'd like Marcus Webb in that meeting, and I'd like a copy of the full board record from tonight's session before I arrive." A brief pause on his end. "I think we can arrange that." "Good," she said. She hung up. The waiting room was quiet. Pelham was watching her. Eli was watching her. Dawes had opened his eyes. She told them what Farr had said, the short version, the facts, without the weight she was attaching to them or the specific feeling of standing at the edge of something that looked like the end of one long chapter and the beginning of whatever came after it. Eli said, "It's done?" "Not yet," she said. "Not completely." Because it wasn't. Harlan on administrative suspension was not the same as accountability. Reyes and Carver were still where they were. Whatever language Harlan had used tonight, in that room, on the record, she didn't know yet what the board was going to do with it, how far they were willing to go, whether inquiry meant consequence or just process. And there was one thing Farr hadn't mentioned that she was already thinking about. The formal statement Harlan had made to the board, that her service-connected injuries had led him to conclude she demonstrated clinical instability, was on the record now. She hadn't put it there. He had. And tomorrow morning, she was going to walk into that building, into a meeting with the board of a hospital where she'd spent 3 years being systematically underestimated, and she was going to bring Marcus Webb and a request for the full record, and she was going to sit across from people who had spent 3 hours tonight finding out who she actually was. She was not going to walk in angry. She was going to walk in the way she'd always walked in, measured, prepared, ready to work. But this time, the full weight of what she carried was going to be in the room with her. She looked at Eli. "Can I see him?" He stood. "Come on." Ghost was in the recovery suite, a padded surface, warm lighting, monitoring equipment running its quiet routine. He was lying on his side with the post-anesthetic stillness of an animal that has been through something significant and is being very quiet about it. The IV was still in. The surgical site was wrapped. His breathing was slow and even. When Nora crouched beside him, his eyes opened. He looked at her with the particular attention he'd given her in the veterinary lobby 2 days ago, that recognition she still didn't entirely know what to do with, and then he exhaled, long and slow, and his tail moved once against the padded surface. She put her scarred hand against his face. "Good," she said. He closed his eyes. And in the morning, she was going to find out exactly how much damage Harlan had done to Reyes and Carver and the others, names she didn't yet have, and exactly what the board was prepared to do about it, and whether inquiry was the beginning of something real or the beginning of another carefully worded dead end. She was going to find out, and she was not going to let it be a dead end. But that was the morning. Right now, Ghost was breathing, steady and slow, and the clinic was quiet, and outside, Denton was dark and cool and ordinary, and for the first time in 2 days, she let herself sit in the silence without filling it with the next problem. She stayed there until he slept. She didn't sleep. Not from anxiety. She had moved past anxiety sometime around the 3rd hour in the recovery suite. The part where Ghost's breathing had settled into something regular enough that her nervous system finally accepted it. She didn't sleep because her mind was doing the thing it did when a situation was nearly resolved but not quite, running through the variables, the known and the unknown, sorting what could be controlled from what couldn't. She drove home at 11:40, showered, sat at her kitchen table with a cup of coffee she didn't finish, and the board record document that Douglas Farr's office had emailed at 10:15, 36 pages of formal minutes, and submitted documentation from the evening session. She read all of it. It took her 2 hours. By the time she set the laptop aside, the coffee was cold and the kitchen was very quiet, and she had a clear picture of what had happened in that boardroom, cleaner and more complete than Obi's updates had given her, because reading the record was different from receiving secondhand reports. Reading it, she saw the shape of the whole thing. Harlan had walked into that meeting believing the record would hold, believing that 7 years of documented performance management, individually justifiable, would read as institutional diligence rather than institutional targeting. He had been wrong about that in the specific way that people are wrong when they have operated inside a system long enough to confuse its tolerance for their behavior with its endorsement of it. The board had not been tolerant. They had been unaware. Judith Crane's 11 pages had made them aware. Marcus's outcomes data had made the cost of that unawareness visible. And Harlan's own words, his formal statement that Nora's service-connected injuries had informed his clinical judgment of her stability, had given the board a problem that no amount of procedural language could absorb quietly. She read that section of the minutes twice. It was worse than Pelham had summarized, which was saying something. Harlan had not merely implied a connection between her scarring and her decision-making. He had stated it. On the record, in response to a direct question from the board chair, he had said that an employee who had sustained significant trauma-related injuries and then concealed their military background demonstrated, and this was the word he had chosen, volatility that warranted ongoing management. He had used the word volatility about a nurse whose 3-year outcomes data put her in the top quarter of the ER division. He had used it, and it was in the record now, and it was not going to come out. Nora closed the laptop. She looked at the kitchen, at the walls of the apartment she had chosen for its quiet and its distance from everything she had been before. 3 years of building mornings here, of making the commute to Hargrove, of learning the rhythms of a hospital that had not known what it had. She was tired, but she was also, and this was harder to name, less familiar, ready. She arrived at the hospital at 8:15. Marcus was already there, which was not a surprise. He was in his office off the charge desk with 2 paper cups of coffee and the expression of a man who had been there since 7 and was not going to mention it. "Board's in the main conference room," he said, handing her one of the cups. "Farr, Whitfield, Ferris, and 2 others I don't know." "Harlan?" "Not in the building." He paused. His access badge was deactivated last night. She took a sip of the coffee. It was better than the cup she hadn't finished at home. "You don't have to be in that room," she said. "I know that," Marcus said, and the finality in his voice was gentle but absolute. He picked up his own cup. "Let's go." The main conference room was the same room where Harlan had told her she was volatile. That was either coincidence or a deliberate choice by someone who understood symbolism. She wasn't sure which, and it didn't ultimately matter. What mattered was the people at the table. Margaret Ferris at the head board chair, a woman in her 60s whose face carried the particular quality of someone who had made a great many decisions over a long career and no longer spent energy on the ones that were straightforward. Douglas Farr beside her. Whitfield across. 2 other board members whose names she got from the introductions, Dr. Patricia Noon, a physician, and Leonard Ash, a hospital administrator from a different regional facility. Nora sat down. Marcus sat beside her. Ferris opened without preamble, which Nora appreciated. "Ms. Callahan, I want to begin by saying that last night's session produced findings that the board considers serious. We're not here this morning to conduct another review of your employment record. We've reviewed it. We're here because we owe you a conversation." "All right," Nora said. "Dr. Harlan has been placed on indefinite suspension with pay pending a full investigation. That investigation will include his conduct in your case and in the cases of at least 5 other employees identified in Ms. Crane's documentation." Ferris's tone was measured, but there was something underneath it. Not anger exactly, more the controlled version of it, the kind that has been through enough bureaucratic process to become something colder and more durable. "I want to be direct with you about what we found. The pattern Ms. Crane documented. 6 employees, all of them nursing or PA staff, all of them flagged within weeks of escalating a clinical concern above an attending physician. That pattern represents a systemic failure of oversight on this board's part. We did not see it. We should have." Nora said nothing. "The statement Dr. Harlan made to this board last evening," Ferris continued, "connecting your service-connected injuries to what he characterized as clinical instability. That statement is going to be reviewed by our legal team and by outside counsel. I won't make promises about outcome, but I want you to understand that what he said was not considered acceptable by this board, not procedurally and not humanly." Marcus, beside her, was very still. "Your administrative leave is rescinded," Ferris said. "Your position is reinstated with full back pay for the leave period. Your personnel file will be corrected to remove the performance improvement plan and the formal note Harlan placed there." She paused. "We're also asking whether you'd be willing to participate in the broader investigation as a witness. You are not required to." But your account of the pattern, and specifically of the meeting yesterday afternoon, would be material. Nora looked at the table for a moment. At the grain of the wood, the marks from years of cups and folders, and the accumulated small pressures of institutional decision-making. She thought about Reyes, who had left the profession, about Carver in Minnesota, about the years those people had spent carrying the specific weight of being wrong-footed by a system that had decided their instincts were liabilities. "Yes," she said, "I'll participate." "Thank you." Ferris made a note. "Is there anything you want to say before we move to logistics?" There was. She had thought about this in the kitchen at 2 in the morning, in the specific way you thought about things when you were tired enough that the strategic layer fell away, and what remained was just what was true. "Reyes and Carver," she said, "and whoever else is in those 11 pages. I want to know that the investigation reaches them. Not just documents what happened to them, actually reaches them, gives them a chance to be heard, and gives this board a picture of what those outcomes cost." She paused. A person leaving the profession is not a neutral outcome. It's a loss with a specific cause, and the cause has a name. Ferris looked at her for a moment. Then she wrote something longer than a note. "Agreed," she said. The logistics took 40 minutes. Back pay calculation, file corrections, formal documentation of the reinstatement, the parameters of the investigation, and Nora's role in it. Leonard Ash from the outside facility had questions about process that were procedurally legitimate and took time. Dr. Noon had questions about the clinical cases, the Ellison decision specifically, that turned into a conversation Nora had not expected, a genuine clinical discussion about escalation protocols and nursing scope, and the specific friction that existed between what nurses could observe and what the institutional structure allowed them to act on. It was the most directly she had been engaged as a clinical professional in 3 years. She answered every question. When it was done, Whitfield walked her and Marcus to the door. He stopped in the hallway, away from the conference room, and looked at her with the straightforward regard of one person who had spent time in the same kinds of situations as another. "For what it's worth," he said, "the citation your colleague submitted, the one from the evacuation." He paused. "I read it before the meeting. All of it." He didn't elaborate. He didn't need to. "What you did for those men and that dog on that road? That's not the kind of thing a person does because they were trained to. Training gets you to the door. What you did is what's behind the door." She looked at him. "Thank you," she said, and meant it without reservation, which was its own kind of unfamiliar. He nodded and went back to the conference room. Marcus walked with her toward the ER. They were quiet for most of it, the comfortable quiet of people who had been in the same place for long enough to not need to fill silence with reassurance. "No one wants to talk more about the escalation protocol," Marcus said finally. "I know. She's on this quality committee." "I know that too." He looked at her sideways. "You could have pushed for more this morning, in that room." "I got what mattered," she said. "You could have pushed for a public statement, named Harlan specifically in the reinstatement notice." "The investigation will do that," she said, "more cleanly than I could." She paused. "I don't want my name attached to his downfall. I want my name attached to my work." Marcus thought about this for a moment. Then, "That's either very wise or very annoying." "Probably both," she said. He almost smiled. "Jets." She went back on shift at 10. There was no ceremony to it. She changed, badged in, went to the charge desk. The morning staff were mid-rotation. There was an MVA in Trauma Bay 2, a pediatric respiratory case in 4, and a backlog in the waiting room that Marcus had been managing with characteristic efficiency. She picked up the handoff notes, read them, asked 2 questions, and moved. The ER didn't pause for personal milestones. It never had. That was one of the things she had always respected about it. The indifference to narrative, the pure prioritization of need. You were useful or you weren't. Your history mattered only insofar as it made you better at the thing in front of you. She was good at the thing in front of her. The MVA patient in Bay 2 was a 38-year-old woman named Tricia with a probable rib fracture and a laceration above the brow that needed suturing. She was frightened and trying not to show it, which Nora recognized immediately and didn't comment on, just worked with, kept the explanation practical, kept the hands efficient, gave Tricia's fear something concrete to organize around. "Is it going to scar?" Tricia asked about the laceration. Nora examined the edges. Probably a little. Above the brow is tricky. She paused. It'll fade. Tricia looked at Nora's left arm, at the sleeve, at the line of scarring visible above the cuff. She didn't say anything, but the look asked something. Nora considered, briefly, the rolled sleeve. The habit of 7 years. She kept working. Mine took about 2 years to fade to where they are now, she said, matter-of-factly. They don't bother me anymore. Tricia was quiet for a moment. What happened? A fire, Nora said. That was true. That was as much as Tricia needed and as much as Nora needed to give. But the difference, the thing that had shifted, was that she said it without the usual reflexive deflection, without the small tactical movement that redirected the question before it could land. She just said it. And then she finished the sutures and told Tricia she'd done well and moved to the next patient. It was a small thing. It was also not small at all. Eli brought Ghost to the hospital 3 weeks later. Not to the ER. Ghost was still in recovery, restricted from anything resembling stress, and Dr. Sorensen had been specific about activity levels in a way that Eli followed with the diligence of someone who had almost lost something and was not going to make that mistake. But Sorensen had cleared him for short, calm visits to familiar environments, and Eli had asked whether Hargrove counted. Nora had said yes. Ghost came through the main entrance on a leash, moving slowly, the post-surgical gait of a dog who had been through something real and was rebuilding from it. He was thinner than he had been. His muzzle seemed more silver, but his eyes were tracking the way they always tracked, alert, specific, selecting from the environment the things that mattered. He found her in 40 seconds. She was coming from the nurse's station when he pulled toward her. Not hard, just the deliberate redirect of an animal that knows what it wants. And she crouched down and he pressed his head against her arm, the scarred one, the same place he always found. "Hey, soldier," she said. His tail moved steadily. Not the fractional movement from the recovery suite. Actually, steadily. Eli watched from a few feet back. He had a slight smile, the kind that didn't announce itself. Some of the day staff had stopped. Delia from Alderman Street had come with Eli and was standing near the entrance with her hands in her pockets. Marcus was at the charge desk pretending to be occupied with something on his tablet. Nobody said anything for a while. Then Dawes appeared from around the corner. He'd driven up from Raleigh, which he'd told Nora about, and which she'd told him was unnecessary, and which he'd done anyway. And he looked at Ghost, and at Nora, and at the small assembled group, and nodded once. Pelham was somewhere in Colorado. Vargas was back in Richmond. Obi was in Baltimore. They had all, in the week since, sent messages, short ones, practical, the communication style of people who said things once and meant them. Vargas had sent a copy of the formal investigation update, which Obi had forwarded from his JAG contact, which confirmed that the regional board's external review had been expanded to include Harlan's full tenure and had formally requested records from the previous 4 years of his performance management decisions. Pelham had sent a photograph. She had it on her phone. She hadn't framed it or done anything dramatic with it. But she looked at it sometimes. The convoy road, the burning vehicle, the angle of light she now knew from 2 perspectives. And she looked at it differently than she had the first time Pelham had put it on the table in the consultation room. Less like a document of something that ended her. More like evidence of something she survived. Those were different things. The investigation into Harlan concluded 6 weeks after that. The formal findings ran to 41 pages, which Judith Crane summarized for Nora in a phone call that lasted just under 20 minutes. Judith had been moved to a temporary oversight role during the investigation, a complicated position that required her to document things she had known and not reported earlier, which she did with the specific accountability of someone who understood the cost of waiting and was not going to minimize it. In one of their conversations, she had said, without prompting, "I should have moved on this sooner. I told myself I was building a case. I was also waiting for something that made it easier." That was wrong. Nora had not told her it was fine. It wasn't entirely fine. But she had said, "You moved when it mattered. That counts." The findings confirmed 6 substantiated cases of retaliatory performance management. Harlan's employment was formally terminated. The board issued a public statement, limited in its specificity, institutional in its language, but real, acknowledging a systemic failure in oversight of ER management practices and committing to a restructured review process for performance actions initiated against clinical staff who had raised escalation concerns. Reyes was contacted. She had left nursing and was working in a health education nonprofit in Phoenix, which was good work and which she said she didn't regret. But in the conversation she had with the investigative team, she had also said that she had left because she had stopped believing her clinical instincts were worth defending against the kind of opposition Harlan had sustained. The investigation finding, the formal acknowledgement that those instincts had been correct, that the opposition had been retaliatory, that the system had failed her, landed on her differently than she had expected. She had said she didn't know yet what to do with it. That was honest. Carver was reached in Minnesota. She had been quieter in her response, reserved, careful, the way someone was careful when they had rebuilt something fragile and weren't sure yet whether the news was a foundation or just more weight. She had asked for time. The investigative team had given it to her. There was no clean resolution to either of those outcomes. Nora had understood from the beginning that there wouldn't be. You couldn't give back the years. You couldn't give back the career Reyes had redirected or the trajectory Carver had lost. What you could do was name it accurately, in a record that would outlast everyone in that room, and not let the naming be the end of it. The board's restructured protocol for clinical escalation complaints included a provision that Nora had submitted in writing, at Ferris's request, 3 weeks into the investigation. It was 3 paragraphs. It proposed a standing review mechanism outside the direct management chain for any performance action initiated within 60 days of a documented clinical escalation by the same employee. Not a guarantee of protection, just a flag. A systemic pause that required someone other than the person initiating the action to confirm the basis was clinical, not retaliatory, small, structural, built to catch the thing that had caught all of them. Ferris had called it sensible. No one had moved it through the quality committee in 2 weeks. It went into policy with a quiet efficiency that was exactly how Nora had hoped it would go. Not with her name attached, not as a spectacle, just as a change that would make the thing work better for the people who came after. 4 months after Ghost had pressed his muzzle against her arm in the Alderman Street lobby, Nora Callahan came to work on a Tuesday in November and did the thing she had done every workday for 3 years. She put on her scrubs, clipped on her badge, and walked into the ER. The morning had the quality of most November mornings. Cold and gray and functional, the sky doing nothing decorative, the hospital parking structure smelling of concrete and exhaust. She had eaten breakfast, which she had been doing with more consistency since the month prior, and she had stopped at the coffee cart in the main entrance, which she had started doing approximately 6 weeks ago, and which the cart operator, a man named Benny, who wore the same Hargrove Regional's baseball cap every day, regardless of weather, now had ready before she reached the counter. These were small changes. They were the texture of a life that had been quietly reassembling itself, not toward some restored version of what it had been before, because that life was genuinely gone, but toward something new that had enough weight to it that it didn't feel provisional anymore. She had not gone searching for it. It had accumulated the way things accumulated when you stopped spending all your energy on containment. Marcus met her at the charge desk. "Ghost is outside," he said. She stopped. "It's 38 degrees. "I know, Ryder's got him in one of those dog coat things. He looks absurd." A pause. "He asked if you had 5 minutes before shift." She went outside. Ely was on the bench near the main entrance, Ghost beside him in a padded green coat that was, as advertised, somewhat ridiculous looking on an aging German shepherd with a silver muzzle and a surgical site that had healed into a thin, competent scar. Ghost saw her come through the doors and stood up with the careful deliberateness of a dog who knew his limits now and worked within them. He walked to her, pressed his head against her arm. She put her hand on his face. They stayed like that for a moment. The dog, the woman, the cold morning. And it was not a moment that required anything from either of them except presence, which was the easiest and the hardest thing. Eli said, "He's been cleared for regular activity. Sorensen signed off yesterday." "Good. He's going to be slower than he was." "That's okay," she said. "So am I." Eli looked at her. There was something in his expression she'd been seeing more often in the past weeks. Not the grief recognition of the parking lot, not the controlled urgency of the clinic. Something quieter. The look of a person who has stopped bracing for a situation to end. "How are you?" he said. Just that. She considered it genuinely, which she hadn't always done when people asked. Better, she said. Yeah? Most days. She scratched Ghost's ear. Some days it's just okay, but most days better. He nodded. That's honest. I'm working on it. Ghost was leaning against her leg. The November wind moved through the parking structure and rattled something metallic somewhere above them, and the automatic doors behind them cycled open for a moment as someone went inside, and the sounds of the hospital filtered out, the ambient noise she had spent 3 years building her life into, and then the doors closed again. I've been thinking about something, Eli said. What? Sorensen mentioned that Alderman Street doesn't have a formal protocol for treating service-connected working dogs. Most of them end up in general veterinary care, and the people treating them don't always know what they're dealing with. The training history, the pain tolerance, the way they mask. He paused. She said she'd been thinking about it for years, never had the bandwidth to do anything about it. Nora looked at him. Finch mentioned that Hargrove has a continuing education program, Eli said, for ER staff. It does. The trauma response piece of it, the human factors part, the way field medicine translates to civilian settings, or doesn't, and what the gaps are. He was watching her face carefully. There's no one teaching that here, or at most hospitals like this. She was quiet. I'm not suggesting anything, he said. You're absolutely suggesting something. I'm observing that there's a gap. Writer. And that you are, arguably, one of the only people in Denton who has both the field experience and the civilian credentials to address it. He stopped. Let it sit. She looked at Ghost, at the surgical scar under the ridiculous coat, at the dog who had crossed a veterinary clinic lobby and upended 7 years of carefully maintained distance. She had spent those 7 years believing that the person she had been on that road was someone she had to contain, that the military medic and the civilian nurse had to be kept separate, that the skills could exist together but the identities couldn't, that letting one be visible meant losing the other. She had been wrong about that. Not completely wrong. She had needed the distance, needed the years of quiet, needed the chance to be someone who wasn't defined by the worst night of her life. That distance had been real and it had been necessary, but she had carried it past its usefulness. The scars on her arm weren't evidence of the worst night. They were evidence of the full night, the decision to go back, the soldier pulled from the burning vehicle, the dog shielded with her own body, the choices made in the seconds when there was no good option and she had made them anyway. The night had cost her. It had also made her. Those were not separate facts. She looked at the hospital doors, at the badge on her scrub pocket that said, Callahan, Nora, RN. She thought about Tricia in the trauma bay, asking about scarring and the rolled sleeve she had stopped adjusting. She thought about Judith Crane's 11 pages, and Ferris reading her commendation into the record, and Whitfield in the hallway saying training gets you to the door. She thought about Reyes in Phoenix and Carver in Minnesota, and the 3 paragraphs she had written that were now policy, a small structural mechanism that didn't have her name on it and would catch things she would never know had been caught. She thought about Ghost, who had found her in a room full of people and walked to her through all of them, because he remembered something the world had decided wasn't true anymore. She scratched behind his ear. He leaned into it. One thing at a time, she said. That's not a no, Eli said. That's not a no, she agreed. She stood up. Eli stood too. Ghost remained pressed against her leg for another moment, then stepped back with the careful gait that was his now. Slower, deliberate, working within the range of what the surgery had left him. He was not what he had been. He was still entirely himself. Nora looked at Eli. I have to go in, she said. Marcus is already giving me the look. Go. She started toward the doors. Stopped, turned back. Tell Sorensen I'll call her, she said, about the protocol. Eli's expression did not change significantly, but something in it settled. Yeah, he said. Okay. She went inside. The ER was already moving. A gurney in the corridor, voices from Bay 3, Marcus at the charge desk with the handoff notes already printed. He handed her the stack without comment. She took it, read the top sheet, asked one question, got her answer, and moved. This was the work. This was what she had built 3 years ago and nearly lost and held and was holding still, not untouched, not unmarked, but intact. The work didn't care what had happened in the conference room or the board meeting or the parking lot or the veterinary clinic at night. It only cared whether you showed up and whether you were good. She was both. She had always been both. That was the thing about spending years being underestimated. It taught you the difference between what other people saw and what was actually true. Those were not always the same thing. Most of the time, they weren't. The institution that looks past you, the supervisor who reads your scars as damage, the system that mistakes your silence for absence, none of them are measuring the right thing. They're measuring what they can see, which is never the whole picture, and the gap between their measurement and the truth is where people like Nora lived and worked and carried others out of burning places. You didn't have to prove it to them. You just had to know it yourself. And then, when the moment came, you stayed in the room. The morning ran long, the way mornings did. She ate lunch in 12 minutes, standing at the nurse's station. She caught a missed potassium abnormality on a post-operative patient, flagged it, stayed with it, until the attending confirmed the intervention. She talked a frightened 18-year-old through a panic attack with the calm efficiency of someone who had been in situations where panic was fatal, and had learned that the most useful thing you could offer a frightened person was not reassurance but steadiness, the specific message that the ground was still there. At 3:15, she passed the bulletin board near the main nursing office, the one that ran hospital announcements and committee postings, and the occasional piece of internal news. She had passed it 1,000 times without stopping. She stopped this time. The policy update was there, printed on standard white paper, formatted in the institutional language of all policy documents. Dense, procedural, not designed to be read by anyone who didn't have a reason. But she had written the 3 paragraphs in the middle of it, and she knew what they looked like, and she found them without searching. Clinical Escalation Review Protocol, Section 4.2, Supplementary Oversight Mechanism. No name, no attribution, just the policy. She stood there for a moment in the corridor of a hospital that had spent 3 years not quite seeing her, and looked at the things she had built out of the wreckage of what Harlan had done. Not to reclaim something, not to punish anyone, but because the gap existed and she knew how to fill it. Then she went back to work. The last patient of her shift was an old man named Walter, 78, with a fall injury and a hip that was going to need surgery. He was frightened in the specific, dignified way of elderly people who had been independent their whole lives and were encountering the terrifying limit of that independence. He didn't want to cry in front of a nurse, which meant he was very stiff and formal about everything, answering questions in clipped, precise sentences and not making eye contact. Nora sat down with him, not perched on the edge of a chair, sat down, made herself level, made the conversation horizontal rather than the power arrangement of standing healthcare provider over lying patient, and waited until he was ready to drop the formality, which took about 3 minutes. "I live alone," he said finally. "I know," she said. "My daughter is in Seattle. We'll call her. She has 2 kids. She can't just—" "Walter," Nora said. "We'll call her. She's going to want to know." He was quiet. "The hip surgery is manageable," she said. "The recovery is real, but it's not endless. You've been managing a lot on your own for a long time." She paused. "It's okay to let people help for a little while." He looked at her directly for the first time. "Is that easy for you?" he said. She considered him. "At his age, you earn directness back." "No," she said, "but I'm getting better at it." He nodded, slowly, the nod of a man processing something that had landed somewhere real. She arranged the call to Seattle. She documented the case. She did the final handoff to the evening shift with the thoroughness she always brought to it, because the next nurse deserved a clean picture of what she was walking into. Then she changed, got her bag, and walked out through the main entrance. Eli was not there. Ghost was not there. The bench was empty, the parking structure ordinary, the November evening settling into full dark. She stood for a moment in the cold outside a hospital where she had spent 3 years being nearly invisible, where she had made decisions that saved people who never knew how close they'd come, where she had been measured by someone who could not see past her scars to the person who had earned them. She had not left. She had not been quiet enough to disappear, or loud enough to be dismissed, or broken enough to stop. She had shown up and kept showing up, and when the moment came, she had stayed in the room. That was the whole of it, really. Not the commendation or the investigation findings or the policy with 3 paragraphs in the middle. Not the veterans in the lobby or Ghost finding her across a crowded room, or the board reading her name into a record. Those things mattered, but they were the evidence of something that had already been true. The truth was simpler and harder and more durable than any of it. She was good. She had always been good. And the years she had spent being told otherwise had not changed that fact, had never touched it, had only built up around it the way sediment built around something solid. Temporary, pressured, eventually moved. She was 34 years old, and she had scars on her left arm that ran from her shoulder to her wrist, and she was not going to roll her sleeve down for anyone who didn't deserve to see her whole. She put on her jacket, walked to her car, and drove home through the dark. The night was clear. The road was open. She had work in the morning. The morning ran long, the way mornings did. She ate lunch in 12 minutes, standing at the nurse's station. She caught a missed potassium abnormality on a post-operative patient, flagged it, stayed with it until the attending confirmed the intervention. She talked a frightened 18-year-old through a panic attack with the calm efficiency of someone who had been in situations where panic was fatal and had learned that the most useful thing you could offer a frightened person was not reassurance but steadiness, the specific message that the ground was still there. At 3:15, she passed the bulletin board near the main nursing office, the one that ran hospital announcements and committee postings and the occasional piece of internal news. She had passed it 1,000 times without stopping. She stopped this time. The policy update was there, printed on standard white paper, formatted in the institutional language of all policy documents. Dense, procedural, not designed to be read by anyone who didn't have a reason. But she had written the 3 paragraphs in the middle of it, and she knew what they looked like, and she found them without searching. Clinical Escalation Review Protocol, Section 4.2, Supplementary Oversight Mechanism. No name, no attribution, just the policy. She stood there for a moment in the corridor of a hospital that had spent 3 years not quite seeing her and looked at the things she had built out of the wreckage of what Harlan had done. Not to reclaim something, not to punish anyone, but because the gap existed and she knew how to fill it. Then she went back to work. The last patient of her shift was an old man named Walter, 78, with a fall injury and a hip that was going to need surgery. He was frightened in the specific, dignified way of elderly people who had been independent their whole lives and were encountering the terrifying limit of that independence. He didn't want to cry in front of a nurse, which meant he was very stiff and formal about everything, answering questions in clipped, precise sentences and not making eye contact. Nora sat down with him, not perched on the edge of a chair, sat down, made herself level, made the conversation horizontal rather than the power arrangement of standing healthcare provider over lying patient, and waited until he was ready to drop the formality, which took about 3 minutes. "I live alone," he said finally. "I know," she said. "My daughter is in Seattle. We'll call her." "She has 2 kids. She can't just—" "Walter," Nora said, "we'll call her. She's going to want to know." He was quiet. "The hip surgery is manageable," she said. "The recovery is real, but it's not endless. You've been managing a lot on your own for a long time." She paused. "It's okay to let people help for a little while." He looked at her directly for the first time. "Is that easy for you?" he said. She considered him. "At his age, you earn directness back." "No," she said, "but I'm getting better at it." He nodded slowly, the nod of a man processing something that had landed somewhere real. She arranged the call to Seattle. She documented the case. She did the final handoff to the evening shift with the thoroughness she always brought to it, because the next nurse deserved a clean picture of what she was walking into. Then she changed, got her bag, and walked out through the main entrance. Eli was not there. Ghost was not there. The bench was empty, the parking structure ordinary, the November evening settling into full dark. She stood for a moment in the cold outside a hospital where she had spent 3 years being nearly invisible, where she had made decisions that saved people who never knew how close they'd come, where she had been measured by someone who could not see past her scars to the person who had earned them. She had not left. She had not been quiet enough to disappear, or loud enough to be dismissed, or broken enough to stop. She had shown up, and kept showing up, and when the moment came, she had stayed in the room. That was the whole of it, really, not the commendation or the investigation findings or the policy with 3 paragraphs in the middle. Not the veterans in the lobby, or Ghost finding her across a crowded room, or the board reading her name into a record. Those things mattered, but they were the evidence of something that had already been true. The truth was simpler and harder, and more durable than any of it. She was good. She had always been good. And the years she had spent being told otherwise had not changed that fact, had never touched it, had only built up around it the way sediment built around something solid, temporary, pressured, eventually moved. She was 34 years old and she had scars on her left arm that ran from her shoulder to her wrist, and she was not going to roll her sleeve down for anyone who didn't deserve to see her whole. She put on her jacket, walked to her car, and drove home through the dark. The night was clear. The road was open. She had work in the morning.